I came to work at Hermann when I was 24 years old, and Dr. Duke was the first physician I ran into.
Dr. Duke was the first person that I saw when I arrived at UT Medical School 31 years ago.
We were going to take this one really sick patient to CT. I actually sat on the floor in the ICU and started crying. He got down on the floor with me and looked at me and said, "Well, hell, honey, I'm going to go with you."
And I was really astonished when he offered to help me move my stuff into my new lab. I was sure that he had more important things to do, and I've never forgotten it.
I'm originally from Germany, and I came here 33 years ago, and when I arrived, Dr. Duke was already on the faculty, the trauma surgeon.
It's the first day on the job, on the trauma service. Me and a few other medical students were out in the hallway, and Dr. Duke came idling down the hallway, and he knew already our names. He spoke to us each by name.
So I met Dr. Duke when I was a fellow here. We then were partners for the last 7 years.
I learned everything about Texas from Dr. Duke.
I joined the Hermann Hospital Board in 1984. We were pals for, I guess, 31 years.
I actually had the privilege and the honor of working with Dr. Duke for 30 years.
When I first started my residency program, July of 1976, that's when I became aware of Dr. Duke and the Life program because I was one among the first residents, pediatric residents, to fly on Life Flight.
It's more like, what do you not admire about Dr. Duke?
You can't work around this medical school or Hermann Hospital without knowing Dr. Duke.
He never seemed to be in a rush. He always had time to chat with you and to catch up on what you were doing.
But the thing I admire the most of him is who he was as a person more than as a doctor.
And there's not one employee that didn't know Dr. Duke, and it's because Dr. Duke knew them.
Being in clinic with Dr. Duke was kind of like being with a celebrity, because so many patients would come in and they weren't expecting him to be their physician that day. Their jaws would just drop. They were like, Dr. Red Dukes is here?
One of the things I loved about him is he always made you feel like you were important.
He had the public persona that so many people saw in his show, but what most people don't realize is how much he cared for people.
I remember a piece I wrote called Living Legend about Dr. Duke, and when I showed him the piece, this was a year ago, he wrinkled his nose and his mustache moved around, and he said, "Why would you want to call me that?" He said, "Go out and talk to the doctors, the nurses, the paramedics, the flight crew. They're upside down in the middle of the night in ditches trying to administer IVs. I'm just the fellow that had the opportunity to get involved and contribute in some way."
I was always stunned that he would have the time to hold a conversation and discuss what was happening in the emergency room and what was happening with me and my family.
That was really a remarkable feature of his personality, the ability to really be the same person to everybody around him, whether they knew him well or whether they didn't.
He would call everybody Bert or Bunny or Sweetie or whatever. And
when he said, "How you doing, bud?" he just genuinely wanted a reply instead of just a greeting.
He would mostly call me honey, but in a warm way.
And every time he would see me, he would say, "Hey babe, what are you up to?"
Because of him, I was given a nickname called Chili Kulkarni.
I don't think I ever actually heard him call me by my name during the month. He would always call me Red.
I was in physician's dining room a couple of times. It was kind of late, and I saw him taking all the leftover food and putting it in boxes and placing it in a cart. The staff told me he was going to take it himself to feed the Life Flight crew.
He was always pushing his rickety old cart from the doctor's lounge to the STICU. And one day I had to ask him, "Dr. Duke, what are you doing? I see you always pushing this cart." And he said, "Mikey," what he called me, Mikey, "the doctors never eat all their food, so I'm going to take it up to the STICU families." And I said, "Okay." And I said, "Well, can't we get you a new cart? That thing's kind of old." And he said, "Well, hell no, Mikey, this cart's making me look like I'm young."
We would all be sitting in the room hearing the checkout from the night before, and they were talking about these really serious surgical cases. And Dr. Duke would come in right before it started every morning, and he would always have this box of donuts. And he'd give the box of donuts to the medical student sitting in the back of the room.
My kids would do things like if he would tell me what size jeans he wore, that I would buy him a new pair of jeans, and then he wouldn't have to wear the ones that had the holes in them. But he liked the ones with the holes in them, just like he liked his old hat that my daughter used to insist cows ran over every time she saw it.
Sometimes I'd brew coffee, and then he'd come and he'd look at it and he'd call it dirty dishwater, and he'd throw it away or something, and then he'd make it himself with like 3 times the amount of coffee grounds in it, and like it would come out cold, black and tarry almost, and that was Dr. Duke's coffee.
The last time we were bumped into each other over here, I was having a little video made, and I said, jump in here and be in this with me. And he said, well, right now I have to take lunch up to the nurse's floor. And he said, but where are you going after that? And I said, a spot I think you can probably find. I said, I'm going to go up to Life Flight. And he said, honey, I'll meet you there.
I got called to my first trauma, and obviously my eyes were as large as saucers. And I think he knew I needed to be calmed down a hair. And he said, so do you like liver and onions? And I said, well, no, sir, I don't. He goes, well, me either. But both of our moms would be really proud that we're in here playing with the liver.
Then when I left Herman and came over to UT, he would stop by my office at least once a week and ask me, when are you coming back to work with me?
I'll remember him asking me if he could go with me to Afghanistan, since that's where he had been very early in his career, and I did a Army deployment into Afghanistan about 4 years ago.
I asked him once to come and do grand rounds in neurology. And again, general surgery and neurology are such separate disciplines, but I just like to say that was one of the most interesting grand rounds we ever had. He had a piece of paper, he stood behind a podium and he told the stories. It's important for us who practice today and for future generations to make sure that those very valuable traits that he demonstrated so admirably are preserved from generation to generation.
I rehearsed with him an address I was asked to give to the first year medical students. I came out with a very strong message, and I asked Dr. Duke whether this would be appropriate to bring before such a big audience, and he said, don't change a word. He also added as an afterthought and said, I sure love to take care of patients.
These last few days, walking in the hospital, it feels like something's missing.
I had the opportunity to operate with Dr. Duke, and most importantly for us, tap into his wisdom every morning at Morning Report. Where we always would turn at the end of a tough case and say, Dr. Duke, what would you do? And he would tell us exactly what to do, and then we would go do it. We're going to really miss him a lot.
He had a heart of gold, cared for people just immensely, and I learned a lot from just watching how he interacted with people throughout the entire hospital.
We all know his legacy with Life Flight, but I think to me his legacy is just caring about others and always his patients first, and his love of teaching and students.
I didn't realize what impact Life Flight would have on the Houston and the Houston surrounding area. But over the years, I realized that this was a very innovative and novel way of getting treatment and transport of patients who needed a higher level of care, immediate treatment.
Because of Life Flight, my husband was saved. Driving his motorcycle home late at night, got hit, and they thought he had passed away. But Life Flight came along, brought him where he needed to be brought to, and to this day he's doing A-okay. Realizing that I was working with the man that created this, that started this, it very honorable, very honorable.
He certainly has united all of us here at the school, and somebody who was loved by everyone, and those are very special people.
But he was a true friend and a true inspiration to me.
We will miss him dearly. I will miss him dearly.
Of course, we'll miss him, but his legacy will be never-ending.
Right up to the day that he passed, he was actually one of my best friends and my confidants. And I will miss that of Dr. Duke tremendously.
He was the face of this hospital for over 40 years, and I'll miss him terribly.